Hi, I'm Dr. Borelli, and I'd like to introduce patients and their decision makers to the New Jersey State Pulse Form. In New Jersey, PULSE stands for Practitioner Orders for Life-Sustaining Treatments. The New Jersey Pulse Form is a single-page doctor order form that specifies patient preferences regarding life-sustaining treatments during the final phases of life. This form can travel with you and is active at home, in the doctor's office, and even in the hospital or nursing facility if you become sick. Like a living will or advance directive, if you are unable to speak with doctors, it will give them instruction on the kind of medical care you want. If you are transferred from one medical facility to another, the Pulse Form will go with you as part of your medical record. It is portable, and by law, all medical staff and healthcare systems must honor it. Having a Pulse Form will help ensure you get the care that you want and avoid the care that you might feel is unnecessary or burdensome. It will also spare your loved ones the very difficult decisions that are sometimes faced during the final stages of life. While the Pulse Form is generally recommended for people who are entering their final years of life, in the state of New Jersey, it's also recommended for those people who want to make clear their preferences for care while they are entering their final stages of life. This means that any adult may have a Pulse Form in the state of New Jersey. The form is a one-page order form that your doctor or nurse practitioner completes with you, only after a discussion they have with you about preferences of care during that time. If you are so sick that you are unable to have this discussion, then your healthcare agent or proxy may assist the doctor or nurse practitioner in its completion. This means that even people who cannot communicate, such as those with dementia, can have a Pulse Form. Why is the Pulse Form important? In the final months or years of your life, you may be in and out of hospitals or skilled nursing facilities. Depending on your medical condition, this can be a confusing time. You might have various options to consider, and your healthcare team may have many medical decisions to make. It can be hard to make sense of it all. Please speak to your doctor to understand the consequences of these decisions and to clarify your wishes. These decisions should be focused on helping you achieve your goals of care. In order to provide the most appropriate care, it is vital that your doctors understand what your hopes and goals are during this time. The goals people have can vary. Some people want only relief from suffering and wish to die a peaceful death at home with loved ones nearby. Other people elect to continue life-prolonging care for a limited time in order to make it to a family event, such as a wedding, or make it to a holiday. Yet others will wish to stay alive beyond the predicted time, regardless of the medical interventions needed to do so. Some want artificial nutrition or life support as long as possible to sustain life, regardless of the need for hospitalization or intensive care. Clearly, there are a wide variety of conditions people face at the end of life, and likewise, there are a range of possible responses to each situation. To help your doctors do the right thing, the New Jersey Pulse Form focuses on each patient's personal goals as a way to guide the medical decisions that are made at this time. To complete the Pulse Form, we start with a clear understanding of your overall medical condition and your prognosis. In other words, the doctor should explain as best as possible what the medical problems are and how much time you may have left to live, and what that time may be like. Without this information, it can be very difficult to decide on treatments such as surgery or chemotherapy or feeding tubes. In order to choose which treatments to consider, you might want to weigh how difficult that treatment might be to undergo or recover from, how risky it might be, and whether its success would extend your life by weeks or by years. With a good understanding of your medical condition, you can assist the doctor or nurse practitioner in pulsed completion. It is not necessary that all sections of the form be completed, but you should know that for any sections that are left blank, the medical team will assume that you want full efforts mentioned in that section. Section A is goals of care and asks about your hopes for the future. Before completing this section with your practitioner, you should have a clear understanding of the diagnosis and prognosis. Without this information, decisions become difficult. Section A is where you make it clear to the doctor or nurse practitioner what is important to you during this remaining time, such as making it to a wedding or a holiday, or living independently, or living as long as you possibly can, or being comfortable at home with hospice care. Section B asks about the scope of medical care. Would you want ICU care or surgery? Or do you prefer that your care be limited to comfort measures only? Here you can let us know whether it's okay to do blood tests or x-rays, and you can specify any other limits that you would like us to observe. One very important consideration is the decision about whether you wish to be hospitalized. If not, this is sometimes referred to as a DNH, or Do Not Rehospitalize order. Please speak to your doctor to understand the consequences of these decisions and to clarify your wishes. These decisions should be focused on helping you achieve your goals of care. Your doctor or nurse practitioner should be able to guide you in making these choices by making recommendations on what to choose. They should tell you if these interventions will help you achieve your goals or not. They should tell you what will work and what will not work in order to achieve your goals. The next section of the form asks about artificial nutrition and hydration. For example, would it be okay if surgeons placed a feeding tube into the stomach if you were unable to swallow? This sometimes happens in patients with strokes or dementia. Sometimes these feeding tubes are temporary and can be removed at a later date. This should be discussed with your doctor or nurse practitioner. The next section, Section D, asks about resuscitation. In other words, should the medical team use CPR and machines to keep the heart and lung going if they cannot work on their own? There's a common misunderstanding in the United States about CPR. Most people believe that it works most of the time. In fact, on TV, when someone's heart stops during a show, about 80% of the time doctors are able to save that person, and at the end of the show, they appear well. In reality, actual survival rate of CPR is much, much less than that. It is very low and approaches nearly zero for those frail seniors with many medical problems. Please speak to your doctor or nurse practitioner and ask their advice regarding resuscitation. The next section is also very important, and it asks you about your healthcare proxy. This is a person who makes medical decisions for you if you are unable to speak with doctors. This section is asking if it's okay for that person to make changes to your pulse form if or when you're unable to communicate. If you already have an advance directive that appoints a healthcare proxy, be sure to use that person's name in this section of the pulse form. You don't want a situation where you have a legal healthcare proxy documented on your advance directive, but have chosen a different person for the pulse form. And finally, at the bottom of the form is a place for signatures. Understand that the pulse form is not legal and valid unless it is signed by a physician or nurse practitioner and also by you. Remember that the pulse form is a tool to organize your medical care to help you achieve your particular goal during your final stages of life. This form does not necessarily promote hospice or withdrawal of treatment. It gives you a way to discuss what you want and do not want when you get to the final stages of life, and it gives you a place to make these wishes known. The pulse form can also be used by those who simply want to clarify their opinions about life-sustaining care, even if they have several years or even decades to live. Some may elect to have their pulse forms completed now, when they're in good health, simply to plan ahead so that they and their family are not burdened by these decisions later on. Although it's suggested the original form be printed on green paper, this is not necessary. In fact, it is very difficult to fax or make Xerox copies of the green form. The form Even the original form may be completed on black and white paper. You should keep a copy of the Pulse form and give copies to all of your doctors. You may even ask your local hospital to keep a copy. Many choose to keep the form on the refrigerator door or in an area where emergency personnel may easily see it if they come to the home. You may also want to make copies and give them to your friends or loved ones. New Jersey Goals of Care is a nonprofit foundation devoted to improving medical decision-making for all New Jersey seniors. We hope you and your family will consider supporting us in these efforts. You can make a contribution on this website or reach us through the email address posted. Thank you very much.